Sometimes in neurosurgery, you have to separate the two hemispheres of the brain. Typically, this is because of an epilepsy disorder, or because the seizures are traveling very fast across what's called the corpus callosum and generalizing very quickly. And these can be called drop attacks, where people have the seizure and they immediately lose tone, fall to the ground. It can be very dangerous. The typical way to treat this is by doing something called a corpus callosotomy. Corpus callosum is one of the large white matter tracts that connects the brain on one side to the brain on the other. It's not the only connection between the two hemispheres, but it's the main one. So, how do you do that? We'll use what's called an interhemispheric approach. And one way to do that is to utilize gravity to your advantage. When we think about how am I going to get in between these two hemispheres to get to the corpus callosum, one way is actually to position the patient on their side, and then when you make your craniotomy, the gravity actually helps pull one hemisphere away from the falx, which is the dural layer that goes in between the two hemispheres of the brain. If you dissect between the two hemispheres, the falx keeps the opposite hemisphere upright, and often we'll use a retractor to pull this side of the brain back. And so if this is your surgeon's eye right here, it offers you a surgical corridor in between the hemispheres so that once you're done with your dissection, you're looking straight at the corpus callosum. While that's what it looks like in like a coronal view, if the patient's laying on their side, from the surgeon's point of view, if you were looking at this, this is something like what you would see, all right? If you have your retractor here, you flip your dura up onto the opposite side. This is if the patient's eyeballs and nose were over this way. So this is the sagittal suture over here. And what you do is you're pulling down the ipsilateral side of the brain. The contralateral side of the brain is held up by the falx. And in this diagram I have here in purple, the pericallosal arteries, which is one of the things that you'll see on your way. And once you've made this dissection, you'll see this just glimmering white sheen over the corpus callosum because it's fully made of white matter tracts. So it's very distinctive, is very clearly white. And then this is your operative corridor. And you're able to go in and just dissect through the corpus callosum all the way anterior and posterior so that the main white matter connection between the two hemispheres is severed, and this stops seizures from generalizing quickly and can be curative for that specific type of seizures called drop attacks.